Hi, my name is Dr. Jason Cormier. I'm a neurosurgeon based in southern Louisiana. I've been studying and treating concussions and traumatic brain injury for several years, and I continue to work with organizations around the world as we fight to resolve this crisis of brain injury. A concussion is an injury to the brain induced by a biomechanical force. It does not require head to head contact. Bumping someone, slapping helmets, landing hard on the ground also result in concussions. Repetitive traumatic brain injuries, in simple terms, is like repeatedly dropping fragile glassware onto a hard surface. Each time the glass is shattered a little more, causing cumulative damages that become more difficult to repair and many times irreversible. At least 1 in 5 athletes will suffer concussion in the next year in high contact sports. In a concussion, the injury to the brain occurs from the movement or motion of the brain as it contacts the internal surfaces of the skull, moving forwards, backwards, and perhaps a second time. And we know that the rotational forces are particularly the most injurious to the brain. While helmets remain critical to head safety, helmets are unable to effectively mitigate the acceleration and subsequent deceleration of the brain, in particular the angular and rotational forces associated with the types of violent motion of the brain generated inside of the skull. We call this slosh. We know that the brain is made up of approximately 70% water. We also know that the mild compression of the jugular brain causes a slight and very safe increase in the volume of blood inside the skull. The Q collar safely provides approximately 1.5 pounds of pressure that is endorsed by the internal jugular vein. This creates a tighter fit for the brain inside the skull, and by reducing the movement of the brain, this apparently reduces the risk of white matter changes in the brain that can lead to the so-called CTE, or chronic traumatic encephalopathy. If the brain doesn't move, the brain doesn't get hurt. Current key focus areas for those studying the brain and the injuries that occur to it entail safety mechanisms with industry support. We know that advances in basic sciences and imaging will provide volumes of real-time information to guide improved treatment modalities. The World Health Organization was right when they predicted that the number one health problem in the world would entail a mental health crisis and the effects of traumatic brain injury. We have learned that the hits that create the highest G forces occur in practice and not so much in competition. Cell therapies like concentrophin aims to decrease edema and increase memory function, but how remains a topic of study. We also know that omega-3 fatty acids in high concentrations with DHA to EPA ratios of 2 to 1 also demonstrates recovery for some forms of traumatic brain injury in addition to some stages of neurodegenerative diseases that can plague both athletes and their families for the remainder of their lives. So why continue to study in relation to athletes and sports participants? This is how they live, so it behooves them to understand the dangers and, more importantly, that there are studies that continue and there are mechanisms and devices like the Q collar that are proven to help protect the brain at some level. In particular, the Q collar is a device like no other, FDA cleared and backed by over 10 years of solid data to mitigate the forces that can result in white matter changes in the brain that can lead to permanent damage. And these were clinical studies in large numbers, hands-on, incorporating neurological examinations with very sophisticated imaging, and the results were acquired by third parties, not by the company, demonstrating changes in the athletes that actually wore the collar versus those that did not. The data is very compelling. Annually, these factorial logarithmic injuries from repetitive head impacts has now become a health crisis exceeding more than $77 billion a year. When we think about the long-term effects, they are most commonly the result of scarring to the brain. Football in particular, we know that some positions are exposed more than others. And as a result, the frequency of brain injury is not only higher, but more injurious in those particular positions. The approach to recovery from repetitive head impacts can be lifelong, with permanent disabilities, potentially becoming unrecognizable to others and to yourself. Both parents and athletes should understand that neurodegenerative changes and those manifestations after repetitive head impacts can show up immediate or they can be delayed for 10 or sometimes 20 years after their retirement from competition. Why is it important to know as an athlete or as a parent? Number one, health and safety. Recognizing the risk associated with repetitive head impacts allows athletes and their parents to make better decisions about participating in those particular sports. It can help in taking the appropriate precautions to minimize the risk associated with traumatic brain injuries. Number two, informed consent. Athletes can make choices about their participation in those particular high contact sports when they understand the potential consequences. Parents too can make decisions regarding their child's involvement and activities with full knowledge of the associated risks. Number three, early protection and management. Knowledge of repeated brain injuries or impacts enables early detection of potential brain injuries, which can lead to timely medical evaluations and management. This can be crucial in terms of preventing long-term damage to the brain. Number four, long-term well-being. Understanding the risk can help athletes and parents prioritize long-term well-being over short-term goals, and the sharing of athletes' health and cognitive functions are protective during and after their sports career. Number five, advocacy for safety mechanisms and measures. Awareness of the issues can lead to the advocacy and improve safety measures and regulations in sports, which will benefit the entire athletic community. In summary, grasping the concept of predictive, preventative impacts are essential for making informed choices, protecting the health and advocacy for safety in the world of sports. So how does the collar protect against repeated head impacts? The Q collar is based on a concept called jugular compression, and the result of this mild, very safe jugular compression both safely and effectively increases the volume of blood inside the skull or cranial vault. This small increase in the volume of blood apparently creates a cushioning effect, thereby reducing the brain's movement within the skull during an impact. This extra blood creates a tighter fit for the brain inside the skull. The result is a reduction of the brain's ability to move or slosh during impact, as this aims to mitigate the consequences of shearing forces that can contribute to traumatic brain injury. In simple terms, it's creating an airbag inside the skull. Recognize that 1.7 to almost 4 million people a year suffer from traumatic brain injury, and approximately 300,000 or more, particularly in football, are sports related. Again, 1 in 5 athletes, particularly participating in high contact sports, will sustain a concussion or brain injury every year. As the total number of injuries across high school sports has decreased since 2005, the total number of concussions has increased by 87%. Remember, if the brain doesn't move, the brain doesn't get injured. Protect your brain. Protect your life. Rely on devices that are proven to protect your brain. Get the Q collar and protect your brain. Thank you.